have seen, as you yourself said about the breast cancer research, the women who had breast cancer, and how just sending out love and compassion to these women improved their health and their survival rate and their longevity. Monks do a lot of meditation. They give and they get a lot of compassion. Do you see any difference in their health? Like, do you feel that there's a way that they manage this, almost like a self-healing process?
Yeah, it's a wonderful question, because I do believe firmly, and even as a medical doctor I believe, that through compassion, through kind of working with our minds, we can heal sometimes disease. Sometimes it doesn't work. What I see monks and nuns who are in long-term meditation in the mountains in rural India, outside of Dharamsala or that whole area of northern India, is they often don't take good care of themselves, they often don't get good food, and they often don't care so much about it. Slowly they're learning. His Holiness the Dalai Lama has been, telling them, eat well, take care of your bodies, and they're slowly learning to do that, but often they don't, and some of them actually don't live real long lives. For them, like one of my very close teachers, Genlam Rinpa, when he was told he had cancer, stomach cancer, he was happy. Well, number one, he said it's going to be a slow death, which it was, that he could practice, and then when he actually died, he could be meditating during the death process. He was looking forward to that. Now, this wasn't a suicide wish.
Right.
He knew, he was very realistic, he knew he had a disease, he went for treatment, he had surgery, he started chemotherapy, and very early in the chemotherapy, I was with him the whole time, very early in the chemotherapy course, he says, enough, I don't want any more. So I tried to tell him, look, these are the benefits, these are the risks, and I think you should have it. He said, no. And I said, okay, you're my teacher. I love you dearly. I don't want to lose you, but this is your decision, and I respect you, and I'll do everything. We'll stand by. I'll help you. So we stopped all that chemotherapy stuff, and he was getting in Delhi, and we went back to his home outside of Gangtok in Sikkim, on the other side of the hill in Chiang Mai. And, I gave him medication for pain when he had it. He didn't take it. He didn't want it. He just wanted to do his meditation, his practice. And in fact, he stayed in Tuktam, this posthumous meditation, after his heart and his breathing stopped. Even though maybe the people meditating, at least that I'm around, they may not live, into their 80s, 90s, or 100s, they have developed incredible qualities that I'm sure will carry forth in their next life. I know his reincarnation, and I was with him just weeks ago.
Maybe it's part of the belief of the continuity of consciousness that does not give them any kind of fear of death. And it's almost like an eagerness to await the next, like a change of costume for a new scene in a play. So they're kind of, excited to move on to the next stage. And maybe it's their training in that sense, the Buddhist training that tells them that it's not the end of something, which I think the Western mind is very fearful of death. But I saw on your website that you frequently help fellow monks go into this meditation during the process of dying, which I'm sure is really beneficial for them. I was just curious that if I'm ever around a person, a close, loved, person in my family maybe, who is dying, this may sound like a little depressing, but I think it's a very important question that intrigues me. Is there any right way to help a person that may be on their deathbed? Are there some do's and don'ts that a layperson could learn from you, because you obviously do it as a proper Buddhist, training?
Yes, there are, and I'll mention a few. I don't quite call them do's and don'ts, not that rigid maybe, but ways that are sort of successful and effective and helpful for both the person that's dying and for the loved ones around. First, I'd like to say that, these high masters that have gone into this special kind of sort of posts are called now post-death meditation. It's not the best terminology, but they're helping me, and they're my teachers usually, and so I'm doing what I can as a doctor, of course, but I'm deriving tremendous benefit being around them, even when they're dying. I think the more we can be natural around someone that's dying, I think that's the most helpful way to be. Because that also puts the dying person at a little more ease to the best that he or she can do. To be non-judgmental and to be a listener. I teach this a lot to doctors and doctors in training, but also to people with cancer that are dying. I'll have a talk I think in a few days, I think on Monday in a couple of days, to people with cancer, living with cancer, to caregivers, all kinds of caregivers. To be natural, to be non-judgmental, just to be there, to show up, to be there. It means a lot to the person that's dying. Not just looking at a watch and running out, feeling uncomfortable and fidgeting and not looking them in the eyes, not being relaxed. Sometimes a touch is marvelous. Of course, it has to be appropriate culturally in the relationship and everything. But a touch, maybe holding the hand, a touch on the shoulder, is remarkable stuff. And we don't have to necessarily do anything. So we're used to so much doing things. Just to relax, to be there, non-judgmental, because they can feel that when we are judgmental. They can feel when we're not judgmental. It puts them at ease as much as they're able. To be a good listener, just to sit. We don't have to say anything. So I think these are just fundamental, basic things that we sometimes forget because we might be fearful, we might be anxious, we might be starting our grieving, we might be very sad. And I think humor is also incredibly important. That doesn't mean you just go in there and you start laughing and the person cracking jokes and the person, that may be very harmful.
Keep it light.
But keep it light and keep it natural. If the person is kind of light and there is something that's funny when you are talking and the person laughs, you laugh, of course. And that really helps the person that's dying. Again, when it's appropriate, So being natural, just being who you are. And sometimes, depending on the relationship, of course, but if it's someone close, to share your feelings. Again, check to see how appropriate that is. But sometimes you can say, I feel sad. That's okay. Again, depending on where the person's at, your relationship and stuff, but you can share your feelings. And sometimes the dying person will open up. And I've had this happen, and I think many of us have had this happen, when the dying person opens up and they share stuff. And it's one of the richest gifts that we, as the person that's there, supporting, can receive from the dying person. It's an incredible gift.
Yeah, one of the things that is very intriguing is this whole concept of when a person goes into coma, for example, or they don't show any normal signs of the vital signs of being alive, like they're flatline on the EEG or their heart rate has stopped and they're being... But I think according to the Buddhist philosophy and other Eastern philosophies, they've just gone into subtle realms of consciousness. So they may not be in the gross level of consciousness, they're in the subtle, but they're not dead. Now, how do you justify pulling the plug for someone? Like the family may think that it's okay for that person to be let go, but that doesn't seem right when they're still alive in a sense.
It's a very controversial area, Sangeeta, and you've sort of suggested that. It may not be right. It's a very controversial area. And I think it's hard to make sort of blanket rules or regulations on this issue. Having said that, I do think, as a Buddhist monk and a medical doctor, I do think it's important to respect the wishes of the person that's dying and the family. So, for example, if the person has discussed with his or her physician, during the illness, when they're quite, able to have this discussion about what they want when they're kept alive, when they have a terminal illness, where the doctors say there's nothing more that can be done, this person's going to die. and they're being kept alive on a respirator so that they can't breathe by themselves. The machine is breathing. They're in a coma, so they can't communicate. And, there seems to be no brain activity when they check, on the EEG.
Right.
And the doctors are saying there's, no hope for recovery. Okay? And they've talked to their doctors previously, and they've signed, these kind of agreements that say, I don't want this life support if I get to that stage.
Yeah.
The family, there may be some disagreement in the family, but if generally the family is supportive of that person's wishes, which they've signed, then I think there's a place for stopping the artificial support. Now, not too long ago, I heard His Holiness the Dalai Lama, when asked the same question about euthanasia, say that there may be a place because of the suffering, because of the terminalness, that there's no hope from the medical community that there's any possibility for cure, and then there's the suffering, and then there's the wish from the side of the person dying, and the family is supportive. He said there may be a place. It has to be evaluated case by case. He said, but you cannot just say 100%
You cannot
no.
generalize. The desire to deal with each situation in the most compassionate way possible.
Yes, now he's not saying, and I'm not saying, that you give lethal injections to people that request it. I mean, that's a different situation.
Right.
So it's very complicated, it's very controversial, but compassion is an overriding principle, if we can talk about a principle.
Yes.
Obviously life from the point of view of a Buddhist, and particularly a Buddhist monk, is sacrosanct. So all of these things, I think, have to be taken into the picture, but there may be situations where, euthanasia is the most compassionate thing to do.